Vitamin B6 plays a vital but often overlooked role in the production of healthy red blood cells, particularly in the synthesis of hemoglobin, the protein responsible for transporting oxygen throughout the body. While iron gets most of the attention in discussions of anemia and blood health, B6 is an unsung cofactor that supports the enzymes required to incorporate iron into hemoglobin and to build the heme molecule itself. Without sufficient B6, the body's ability to produce fully functional red blood cells diminishes, which can result in symptoms that closely resemble iron deficiency anemia, fatigue, weakness, dizziness, shortness of breath, and pale skin, yet with a different root cause. The active form of B6, pyridoxal 5-phosphate, PLP, is essential in the synthesis of deaminolevulinic acid, ELA, a precursor in the heme biosynthetic pathway. ELA is the first committed step toward building the heme ring structure that eventually binds iron and carries oxygen within hemoglobin. When PLP is deficient, ALA production slows down, impairing the entire hemoglobin synthesis process. This leads to red blood cells that are underdeveloped and less capable of delivering oxygen efficiently to tissues, mimicking classical anemia despite normal or even elevated iron stores. The result is a functional, B6, responsive form of anemia that is frequently misdiagnosed and mismanaged. Because iron deficiency is far more commonly tested and more commonly assumed, many individuals with B6-related anemia go undiagnosed or receive inappropriate treatment. Iron supplements may be prescribed, even when iron levels are already adequate or high. In such cases, the additional iron can accumulate in tissues unnecessarily, contributing to oxidative stress and inflammation, while the underlying B6 deficiency continues unchecked. This misattribution of cause not only delays effective treatment, but can also exacerbate symptoms over time. It's a classic case of treating the symptom while missing the mechanism. B6-related anemia is typically classified as microcytic, small red blood cells, similar to iron deficiency anemia. However, in some cases, especially with concurrent deficiencies or chronic disease, it may present as normocytic, normal-sized cells but in lower numbers, which further clouds the diagnostic picture. Since B6 status is rarely tested as part of a standard anemia workup, clinicians may never suspect that a vitamin deficiency is responsible. This is particularly concerning in populations already at higher risk of B6 depletion: the elderly, alcohol users, individuals with chronic inflammation, and those on certain medications like isoniazid or hydralazine. The connection between B6 and red blood cell health extends beyond just hemoglobin. PLP also supports enzymes involved in amino acid metabolism that maintain the structural integrity and lifespan of red blood cells. When B6 is lacking, these metabolic pathways falter, potentially leading to shortened red blood cell survival and increased oxidative vulnerability. This subtle form of cellular fragility can further contribute to symptoms like chronic fatigue or exercise intolerance, even when traditional anemia markers appear only mildly abnormal. Furthermore, the symptom overlap between B6 deficiency and other common causes of fatigue, like low thyroid function, stress, or sleep issues, makes it easy for this nutrient shortfall to go undetected. Because B6 does not produce an easily recognizable disease in its early stages, it remains underprioritized in standard diagnostics. Yet in functional medicine circles and advanced nutritional labs, clinicians often observe that restoring optimal B6 levels can significantly improve energy, oxygenation, and stamina, especially in individuals who have been told everything looks normal despite persistent symptoms. What complicates matters further is that iron supplementation in the absence of a true deficiency may actually worsen B6 status. High doses of iron can interfere with the absorption of other nutrients, including B6, and increase oxidative stress in the gut lining, making it more difficult for micronutrients to be properly absorbed. This creates a frustrating cycle. A person feels tired, is prescribed iron, continues to feel tired, and the real cause, B6 insufficiency, remains unaddressed. In these scenarios, a well-informed approach that includes checking B6 status or using a broader spectrum nutritional intervention may be far more effective and safer than reflexively resorting to iron therapy. In summary, vitamin B6 is a key player in red blood cell production and hemoglobin synthesis, quietly supporting the very process that delivers oxygen to every cell in the body. Its deficiency produces anemia-like symptoms that are often misattributed to iron shortfall, resulting in misdiagnosis, mistreatment, and prolonged discomfort for the patient. By recognizing B6's role in hematologic health and incorporating it into diagnostic evaluations, especially in cases of unexplained fatigue or borderline anemia, clinicians and patients alike can gain a more complete understanding of what's truly needed to restore vitality and oxygen balance. In a world where fatigue is epidemic and energy is prized, B6 may be the missing nutrient that quietly restores the spark.